Okay, this is Scott Cochran again, and we are in the middle of my oral presentation for my capstone project for the MBA program at Western Governors University. We are talking about developing sustainable solutions, and I just presented an example of a strategic reduction in force that I was able to carry out using some of the strategies of leadership that I had learned in this program. Another example was the successful restructuring of the cardiac service line. As I was promoted through the facility, it had a tendency to leave a few gaps. So there were a few performance issues in two departments. As I analyzed that situation, I felt like each of the areas needed a more formal power structure in their daily operations. As such, I promoted two individuals to be supervisors of these two various departments. I gave them the support that I give other supervisors, and they were able to improve employee satisfaction as well as operational activities. I think that, again, my analytical approach to looking at what the problem was in that area and coming up with a solution that was sustainable. Serving customers. I believe that I am empathetic to the needs of others. I've worked with patients and families for a number of years. I am able to put myself in their position, and I am able to relate to them personally. As a result, I believe that I'm an effective communicator and that I have the ability to resolve conflict. I also have the ability to design effective customer service processes. I can also identify internal and external customers. Internal customers are a little trickier in that there are boundary issues as well as political issues to deal with. I feel like I have effectively managed the line between boundaries and services, and my communications with other leaders in the organization are always politically correct. I have not had any wars with any other departments. I've been able to identify the departments that I'm a customer to, and also identify the departments that are customers to my areas. And I always seek to operate that way, as if they were customers. Physicians and physician offices are also customers, and I've been able to walk the line with the physicians as well. Problem solving with physicians is always a big challenge, but I have been able to do it, and it has served me well. Managing products and services. Products. I manage a huge inventory with the cath lab and interventional radiology departments. I have the ability to effectively use inventory resources. I'm in the process of switching from manual type inventory to computerized inventory, where it'll be the tracking will be barcode driven, and I will be putting into practice some of the inventory management strategies that I learned in this program. I have a good understanding of the supply chain process. I use effective cost reduction strategies whenever I can. I manage the flow and usage of products, and I monitor trends. Along with products comes revenue, because when you use products, you have to get reimbursed for them. So I'm able to use the cost to charge ratios to set prices for the products that we use. I monitor the revenue chain. I use the financial reports to predict future trends, and I formulate budgetary guidelines. Healthcare is always a tricky, it's a tricky business. because I work in a nonprofit setting. So even though our main business objective is taking care of the patients that we serve, we can't do that without turning a profit. So while it's a nonprofit facility, we still operate as if we have to make a profit, because in a sense we do. We wouldn't be able to replace our capital equipment if we weren't able to make a profit. Managing services is the same way. You have to manage a service at a profit. I have a history of establishing effective processes for healthcare delivery in the departments that report to me. I set the standards for clinical competency. I monitor the clinical competency. I monitor the outcomes of the healthcare delivery in my departments. I effectively use human resources for the benefit of the patient. I manage the healthcare processes with respect to the regulatory environment. I monitor compliance and alter practice when regulations change. Managing technology and innovation. Another way I like to put that is effective change management strategies, because that's what managing technology and innovation is all about. It's always changing, it's always growing, especially in the world of advanced imaging, CT, MRI, procedures. They're always changing, there are always new innovations, there's always things on the horizon. And so managing the technology and innovation is synonymous with managing change. I use that through formal project management type projects, as well as more informal. I plan future implementation strategies for advanced imaging. Right now I'm working on PET-CT, that we're going to be advancing our imaging capabilities at Carson Tahoe to include PET-CT. It's a $2.5 million project, and it's going to take a lot of control. I'm responsible for the continuing education of clinical staff, and I am participating in the ongoing conversion to electronic medical health records, which is also a huge process of change. Assessing the competitive environment. I've always been patient-focused. In fact, my history is one patient at a time, so competition wasn't something that I was really that concerned about. My leadership has evolved to where now I'm responsible to care for a population in a primary and secondary service area. So I have a new appreciation for concerning competitor service lines. I have the ability to perform SWOT analysis of internal services and compare those to external competitors. With an established business goal of managing the health of a given population, but providing the service profitably. Planning for the future in a global marketplace. I believe medical tourism is not a significant threat to my business model. Therefore, all healthcare is local. So I have to manage the competitive threats on a local level. I've seen a big trend of this right now, of doing this through vertical and horizontal integration. One of the vertical integrations that we're witnessing right now is the purchase of physician practices, and that's a way of controlling the inputs. You have to demonstrate continuous learning regarding the local and national political reforms. Excuse me, but it seems as if I'm running out of time on this particular file as well, so I'm going to actually have to go to a third file. So I'll be right back.